Before we begin, I need to give you a content warning. This episode discusses suicide, depression, and mental health struggles in detail. If you are currently in crisis, please pause this episode and call 988 for the Suicide and Crisis Lifeline, or text HOME to 741-741 for the crisis text line, or call the physician support line at 888-409-0141. Help is available. You don't have to listen to this episode right now. You can get help first and come back to this later. If you're in a place where you can listen, I'm glad you're here. This conversation might be difficult, but it's necessary, and you are not alone. I have contemplated suicide on several occasions. I can't tell you exactly what triggered those moments. I can't tell you exactly how I got out of them. I just know that I am still here, and I want you to be here too. Hello, I'm Dr. Felix Boecker, and today we're talking about something medicine doesn't want to discuss. Physicians are killing themselves at alarming rates, and we need to talk about it. Welcome to In Search of 42. Let me give you some statistics. About 300 to 400 physicians die by suicide every year in the United States. That's roughly one physician per day. One per day. Think about that. These are people who dedicated a decade or more of their lives to helping others. People who sacrificed their 20s and 30s to become healers. People who took an oath to do no harm. And they couldn't save themselves. Or they didn't feel like they could ask for help. Or they asked, and the system failed them. Physicians have one of the highest suicide rates of any profession. Medical students experience depression and anxiety at rates significantly higher than the general population. Residents report symptoms of burnout at rates exceeding 50%. This is not rare. This is not unusual. This is epidemic, and we don't talk about it enough. But today, I am going to talk about it. I am going to tell you about my own struggles with suicidal ideation. I am going to tell you about my brother who we lost to his own mental health struggles. I am going to tell you about the barriers that keep physicians from getting help. And I am going to tell you how to get help. Because if you're listening to this and you're struggling, I need you to know something. You are not alone. You are not weak. You are not broken. And there is help available. I have depression. I've had it for a long time, and I have contemplated suicide on several occasions. I can't tell you exactly what triggered those moments. Best I can tell, it was a loss of identity, a loss of self, having to do work that simply didn't resonate with me. Feeling trapped in a path I couldn't get off. Feeling like I had become someone I didn't recognize. I wish I knew what got into me during those times. I also wish I knew the secret to snap out of it. Maybe snap out of it isn't the right choice of words, but I just don't know how to get out of those deep, dark moments. What I do know is this. A key is having someone, anyone, to call and reach out to. And that's the hardest part. Your phone becomes a 1,000-pound object. It's difficult to pick it up and make that call. But that's exactly what you need to do. I never had someone I could truly confide in. I went through all those struggles alone, by myself, and that made it so much harder. I'm boneheaded and strong-minded, and somehow I pushed through those moments, but I can't tell you exactly how. And that terrifies me. because I want to be able to give you a roadmap. I want to be able to say, here's what to do when you are in that place. But I don't have a clear answer. What I can tell you is what's helping me now. I have a therapist I see regularly. I'm doing ketamine therapy. I'm on medications that help stabilize my mood. And I've changed my medications when the old ones weren't working. These things help, but they're not a cure. My depression is with me every day. Every day is a new struggle. Some days are easier than others, but I always live in fear of waking up in a depressed mood. And when I do wake up depressed, I take it one step at a time. I control the controllables. I can't control what tomorrow brings. I can only control what is in front of me right now. That's how I function as a physician, a coach, a partner, a father. One step at a time, one day at a time, sometimes 1 hour at a time. Let me tell you something about depression that people don't understand. I know, intellectually, that my thoughts are wrong when I'm depressed. I know that the hopelessness isn't based in reality. I know that the feeling that nothing will ever get better is a symptom and not the truth. I know this, but it still feels emotionally right to be down. The thoughts feel true even though I know they are not. That's the paradox of depression. You can know something is a distortion and still believe it completely. You can know you should reach out for help and still feel like there's no point. You can know objectively that you have people who care about you and still feel completely alone. That disconnect between knowing and feeling is maddening. And it's why just think positive or just remember all the good things in your life doesn't work. Because I do remember those things. I know those things. And the depression doesn't care. It tells me those things don't matter. It tells me they won't last. It tells me I'm still going to end up alone and miserable no matter what. And even though I know that's the depression talking, it feels true. That's what makes it so dangerous. In 2024, I lost my brother. His name was Moritz. He was an alcoholic. He dealt with mental health issues all by himself. He never received the help he needed and deserved in time. He was a brilliant guy, an automotive engineer with a great career. He worked at Daimler-Benz, Tesla, and Zoox. He was accomplished, he was intelligent, he was talented, and he was struggling. I knew the day was coming when I would find out that he was dead, but it still caught me by surprise. I still have days when I miss him terribly. What bothers me is that his life was wasted. A brilliant guy who would have accomplished so much good in the world. But he chose to end his life with alcohol instead. It bothers me to think about how much wasted potential is out there in the world, how many brilliant minds we're losing, how many people who could have made a difference are gone because they didn't get help, or because they tried to get help and the system failed them. That's what happens when we lose people to mental health crises. We're left with questions. We're left with regret. We're left wondering what we could have done differently, what we could have said, how we could have helped. And the truth is, sometimes there is nothing you can do. Sometimes people are too far gone. Sometimes the system fails them despite everyone's best efforts. But sometimes, and I want you to hear this, sometimes reaching out makes all the difference. Sometimes asking for help saves a life. Sometimes one phone call changes everything. And we will never know which time that will be. So we have to try every time. Let me give you more context about the scope of this crisis. 300 to 400 physicians die by suicide every year. That's one per day. But that's just completed suicide. That doesn't count suicide attempts. That doesn't count the physicians who are actively suicidal but haven't acted on it yet. That doesn't count the physicians who are severely depressed and contemplating it. If you include all of those, the numbers are staggering. About 1 in 3 medical students experiences depression. Residents report burnout at rates exceeding 50%. Physicians have access to lethal means. We know pharmacology, we know dosing, we know what will work quickly and effectively. That makes us more likely to die on a suicide attempt than the general population. We also tend to be perfectionists, high achievers, people who have spent our entire lives succeeding. And when we fail, or when we feel like we're failing, we don't know how to cope. We don't know how to ask for help. We've been taught to be self-sufficient, to power through, to not show weakness. And that kills us. So why are physicians killing themselves at such high rates? Is it just the stress? Is it just the long hours? No. It's more complicated than that. Here's what the research shows, combined with what I have lived and learned. Factor 1, personality traits. Medicine selects for certain personality types: perfectionists, high achievers, people who delay gratification, people who are willing to sacrifice themselves. These traits help you get through medical training, but they also make you vulnerable to depression and suicide because you don't know how to fail. You don't know how to be imperfect. You don't know how to ask for help. Factor 2, the training culture. Medicine normalizes suffering. Working 80 to 100 hours a week is a badge of honor. Not sleeping is expected. Complaining is weakness. We're taught to ignore our own needs. We're taught that the patient comes first, always, no matter what. We're taught to compartmentalize our emotions, and we're never taught how to process trauma, how to grieve, how to cope with the things we see. We just stuff it down and keep working. Factor 3, loss of autonomy. Modern medicine has stripped physicians of autonomy. We don't control our schedules. We don't control how we practice. We spend more time on documentation than with patients. We fight with insurance companies. We're told how to practice by administrators who've never seen a patient. That loss of autonomy creates moral injury. We went into medicine to help people, and we're prevented from doing it effectively. That's soul-crushing. Factor 4, the expectation versus reality gap. We go into medicine thinking we're going to save the world, cure diseases, make a difference. And then when we get there and realize we're instead fighting for prior authorizations, we're dealing with patient noncompliance, we're managing chronic diseases that never get better, we're losing patients despite our best efforts. The reality doesn't match the expectation, and that's devastating. Factor 5, stigma around mental health. Medicine stigmatizes mental health issues. Admitting you're struggling is seen as weakness. Asking for help can threaten your career. Licensing boards ask about mental health conditions. Hospitals ask during credentialing. And even though, in theory, seeking help shouldn't affect your privileges, can you really trust the system to treat you fairly? Once you're established and you have clout, it's easier to ask for help. You know the hospital has your back. But early on, when you don't have a reputation yet, it could be much easier for the hospital to just let you go. So, people suffer in silence. They hide their struggles. They don't get help until it's too late. Or they never get help at all. Factor 6, access to lethal means. Physicians know how to kill themselves effectively. We have access to medications. We understand dosing and pharmacology. We know what will work. That makes us more likely to die on a suicide attempt. Factor 7, isolation. Many physicians are isolated. We work long hours. We don't have time for relationships outside of medicine. We lose touch with friends and family. We become our job and nothing else. And when you're struggling, that isolation is deadly because you have no one to reach out to, no one who will notice you're not okay, no one to intervene. All of these factors combine to create a perfect storm. A profession that selects for vulnerable personality types, a training culture that normalizes suffering, a practice environment that creates moral injury, a stigma that prevents help seeking, and access to lethal means. That's why physicians are dying. Let's talk specifically about the barriers that keep physicians from getting help. Barrier 1, licensing concerns. Every state medical board asks about mental health conditions. The questions vary, but many ask something like, do you have any mental health condition that affects your ability to practice medicine? How do you answer that question honestly without torpedoing your career? Here's my take. You can honestly answer no as long as your mental health issue doesn't in fact affect your job performance. Depression that you're managing with therapy and medication, that's not affecting your job performance. That's you appropriately treating a medical condition. But there's fear around this, justified fear, because we have seen physicians lose their licenses for admitting to mental health struggles. We've seen physicians denied privileges. We've seen careers ended. So people lie. They say they're fine when they're not, and that prevents them from getting help. Barrier 2, hospital credentialing. Every year, for hospital credentialing, we have to answer questions about our mental health. Do you have any mental health issues affecting your job performance? Again, in theory, this should not affect our hospital privileges. But can you really trust the hospital system to treat you fairly? I often wonder if mental health is swept under the rug in other high intensity professions for similar reasons. I'm thinking about pilots, especially. If you're admitting you're depressed, means you lose your license to fly, are you going to admit it? Or are you going to suffer in silence and hope you can push through? That's the impossible choice we're forcing people to make. Barrier 3, stigma from colleagues. If you admit you're struggling, your colleagues will judge you. They'll wonder if you're competent. They'll question whether you can handle the job. They'll see you as weak. That stigma is real and it's pervasive. Even in 2025, even with all the talk about physician wellness, the underlying culture hasn't changed that much. Toughness is still valued. Weakness is still punished. Barrier 4, time and access. When you're working 80 to 100 hours a week, when do you have time for therapy? When do you have time to see a psychiatrist? When do you have time to attend appointments? And if you're in a small town or rural area, there might not even be mental health resources available. The barriers are practical as well as cultural. Barrier 5, cost. Therapy is expensive, especially if you need weekly sessions. Medications are expensive. Alternative treatments like ketamine therapy are expensive and often not covered by insurance. And when you're a resident making $60,000 a year with $300,000 in debt, that cost is prohibitive. Barrier 6, not recognizing the problem. Sometimes the biggest barrier is not recognizing that you need help. You tell yourself everyone feels this way. You tell yourself it's just residency, it will get better. You tell yourself you can handle it. You tell yourself it's not that bad. And by the time you realize you need help, you're in crisis. All of these barriers keep physicians from getting the help they need, and people die because of them. So, how do you know when someone is at serious risk? How do you know when you need to intervene? Here are some warning signs I have learned to watch for. Warning sign number 1, pretending everything is fine. A lot of times, those who don't admit their struggles, who pretend everything is just fine, are the ones most at risk because they're hiding, they're isolated, they're not getting help, and no one knows they're struggling. Warning sign number 2, sudden changes in behavior, withdrawal from friends and colleagues, loss of interest in things they used to enjoy, changes in sleep or eating patterns, increased substance use. These are all red flags. Warning sign number 3, talking about death or suicide. If someone is talking about wanting to die, take that seriously. Don't dismiss it as venting. Don't assume they're just having a bad day. Take it seriously. Warning sign number 4, giving away possessions. If someone is suddenly giving away important belongings, that's a major warning sign. They're preparing. This isn't common, but when it does happen, you need to be aware of it. Warning sign number 5, sudden calmness after depression. If someone has been severely depressed and suddenly seems calm and at peace, that can be a sign that they've made a decision to end their life. The internal conflict is over. They're decided. And that's when intervention is critical. Warning sign number 6, researching methods. If someone is researching suicide methods, looking up lethal doses, asking about access to means, that's an emergency. In yourself, the warning signs might feel different. Persistent thoughts about death, feeling like a burden to others, feeling trapped with no way out, unbearable emotional pain, a sense that things will never get better. If you're experiencing these, you need help immediately. Not next week, not when you finish this rotation, but now. Let me tell you what's actually helping me, because I don't want to just talk about the problem. I also want to talk about solutions. What's helping me is therapy. I have a therapist I see regularly, not just when I'm in crisis, but regularly. We work on understanding my patterns. We work on coping strategies. We work on processing the things I've experienced. Now, therapy isn't a quick fix. It's ongoing work, but it helps. Medications. I'm on medications that help stabilize my mood. And when the medications weren't working, I changed them. There's no shame in medication. Depression is a medical condition. Would you refuse insulin if you had diabetes? Would you refuse chemotherapy if you had cancer? Why would you refuse medication for depression? It's a medical treatment for a medical condition. Ketamine therapy. A friend of mine suggested ketamine when I was in one of my dark moments. I had heard about ketamine before, but never thought it was possible for me to do here in Toledo. So I was open to the idea because my medications were obviously not helping at the time. Thankfully, there is a therapist in my area who does ketamine therapy, and my friend connected me with her. Ketamine has been helpful for me. It's not a cure, but it helps. It provides relief when nothing else does. It allows me to see my thoughts from a different perspective. It breaks the rumination cycle. If you're interested in ketamine therapy, make sure you're doing it right. The right setting, right dose, right environment, with integration therapy afterwards. It's not just about the drug, it's about the therapeutic process around it. I have struggled with this all my life, but I have built connections. I have my therapist. I have my fiance. I have a few people I can reach out to when I'm struggling. That's essential. You need someone, anyone, someone you can text or call when you're in a dark place, someone who will answer, someone who will listen. Control the controllables. When I wake up depressed, I take it one step at a time. I can't control what tomorrow brings. I can only control what's in front of me right now. What do I need to do in the next hour? What's the next small step? I focus on that. Not the whole day, not the whole week, just the next step. Now, what doesn't help is rumination. My own ruminations definitely make things worse. I know I'm not well. I know my thoughts are wrong, but it still feels right to be down. When I get stuck in rumination, in going over and over and over the same negative thoughts, it spirals. I have to actively interrupt that pattern. sometimes with distraction, work, hobbies, exercise, sometimes with therapeutic techniques, sometimes with medication. But rumination is the enemy. If you're listening to this and you're in crisis right now, here's what you do: call 988. That's the Suicide and Crisis Lifeline. It's available 24/7. You can call or text. They have counselors who are trained to help. They have specific services for veterans as well. If you're a veteran or active military, tell them. They'll connect you to specialized support. You can text HOME to 741 741. That's the crisis text line. If you prefer texting to talking, this one's for you. Also available 24/7. Call the physician support line at 888-409-0141. This one is specifically for physicians and medical students. It's confidential. It's staffed by psychiatrists who understand the unique pressures of medical training and practice. They get it. They won't judge you. They'll help you figure out the next steps. If you're actively suicidal, if you have a plan, if you don't trust yourself to be safe, you have to go to the nearest emergency room. Yes, it might affect your hospital privileges temporarily, but you will be alive. And alive is what matters. Everything else can be figured out later. Remember, you have to tell someone, anyone, a friend, a family member, a colleague, your program director, your therapist if you have one, anyone. I know your phone feels like it weighs 1,000 pounds. I know making that call feels impossible, but you have to do it. That's the thing that saves your life. That phone call, that text, that conversation. If you're listening to this because you're worried about someone else, here's what you do: ask directly. Are you thinking about suicide? Don't dance around it. Don't worry that asking will put the idea in their head. It won't. Ask directly. Then listen without judgment. If they say yes, don't panic. Don't tell them they have so much to live for. Don't tell them it will get better. Just listen. Let them talk. Let them feel hurt. And don't leave them alone. If someone is actively suicidal, do not leave them alone. Stay with them. Get them to help. Call 988 together. Go to the ER together. Call their therapist together. But do not leave them alone. Remove access to means. So if they have medications, take them. If they have weapons, remove them. Make it harder for them to act on that impulse. And follow up. After the immediate crisis passes, follow up. Check in regularly. Let them know you're there. Let them know you care. Don't assume they're fine just because the crisis moment has passed. And take care of yourself too. Supporting someone who is suicidal is exhausting. You cannot do this alone. Get support for yourself. Talk to a therapist. Talk to friends. You cannot pour from an empty cup. So, can we fix this? Can we reduce physician suicide rates? I wish I knew the answer. The statistics haven't changed much over the last 20 years, despite all the talk about physician wellness, despite all the programs and initiatives. We're still losing 300 to 400 physicians per year. I think it's partially a systems issue. Work hour restrictions help, but they're not enough. Wellness programs help, but they're not enough. Reducing stigma helps, but we haven't really reduced it. But it's probably more than just systems. Highly intellectual people in high intensity professions seem to have high risks for suicide. Is that just the nature of these professions? Is it the personality types they attract? Is it the work itself? I often wonder if it has to do with the process of choosing some of the brightest minds in the world, hoping to change the world's problems, and then putting them in high intensity, high stakes environments where they fight not for the world's problems, but for individual people's lives. It's probably a combination of systemic issues and individual personality traits of those choosing this career. Here's what I think would actually help. Some of these are, at least in theory, easy fixes. Most of them, though, will require a lot of work to put into practice. 1. Removing the licensing and credentialing questions about mental health. Stop asking about mental health conditions. Ask about current impairment. That's what actually matters. Someone with depression who is being appropriately treated is not impaired. Someone with untreated depression might be. Focus on function, not diagnosis. 2. Make mental health care accessible and affordable. Free therapy for all medical students and residents, free psychiatric care, time off for appointments without penalty. Make it easy to get help. 3. Change the training culture. Stop glorifying suffering. Stop hazing residents. Stop normalizing 100-hour work weeks. Stop telling people they're weak if they need help. Create a culture where asking for help is normal, where taking care of yourself is expected, where mental health is treated the same as physical health. 4. Address the moral injury. Give physicians back some autonomy. Reduce administrative burden. Let us practice medicine the way we were trained. Stop the prior authorization battles. Stop the insurance companies' interference. Let us actually take care of patients. 5. Create better support systems, peer support programs, mentorship programs, mental health check-ins as part of routine practice. Don't wait for people to reach out. Check in proactively. Now, will these things fix the problem completely? I don't know, but they would help. And right now, we're not even doing these basic things. Let me tell you something important, though. It can get better. I know that's hard to believe when you're in the darkness. I know it feels like it will never get better, but it can. I'm still here, still struggling, yes, still managing my depression every day, yes, but I am here. I have a career I've built on my terms. I have a coaching business. I have this podcast. I have a fiance I love. I have my kids. I have hobbies, woodworking, soccer, coding. I have a life outside of medicine. It's not perfect. Some days are really hard. Some days I wake up depressed and I have to fight through the entire day. But there are also good days. Days when I feel okay. Days when I feel more than okay. Days when I'm glad I'm still here. Recovery isn't a straight line. It's not you get help and then you're cured. It's ongoing management. It's learning to live with depression as a chronic condition. It's building support systems. It's taking your medication. It's going to therapy. It's reaching out when you're struggling. It's taking it one day at a time. It's possible. A better life is out there. Help exists. The system can eventually change, and you are not alone. There are thousands of physicians struggling with the same things you're struggling with. There are people who understand. There are people who care. There are people who want you to live. I want you to live. I'm talking to you right now because I want you to live. Because the world needs you. Because your patients need you. Because your family needs you. Because you deserve to live. You deserve to get help. You deserve to feel better. You deserve a life that's worth living. And that life is possible. It might not feel possible right now, but it is. I promise you, it is. If you're listening to this and you're struggling, here's what I want you to know. You are not weak. Asking for help is not weakness, it's strength. It takes courage to admit you're not okay. It takes courage to reach out. It takes courage to keep going when everything in you wants you to give up. You are not alone. I have been where you are. I know that darkness. I know that hopelessness. I know that feeling that nothing will ever get better. And I also know that it can get better. It won't be easy. It won't be quick, but it is possible. You are not a burden. Your life matters. Your presence in this world matters. The people who love you want you here. Your patients need you. The world needs you. Please don't give up. Please reach out. Please get help. Pick up that 1,000-pound phone, make the call, send the text, tell someone, anyone. That's the first step. That's how you start to get better. And if you can't make the call for yourself, make it for someone else. Make it for your kids. Make it for your parents. Make it for your patients. Make it for the future patients you haven't met yet who need you. Make it for the person you could become if you get through this. Just make the call, please. We are losing too many physicians to suicide. 300 to 400 per year. One per day. That's 300 to 400 brilliant minds gone. 300 to 400 healers lost. 300 to 400 people who could have made a difference. We cannot keep losing people like this. We have to do better. We have to change the culture. We have to remove the barriers to care. We have to make it okay to ask for help. And individually, we have to reach out. We have to check on each other. We have to create support systems. We have to normalize struggling. We have to normalize getting help. Because this crisis won't end until we change the culture. And the culture won't change until we start talking about it. So I am talking about it. I'm telling you, I have struggled. I'm telling you, I still struggle. I'm telling you, I get help. And I'm telling you that help works. It's not perfect. It's not a cure, but it helps. And helping is enough. Surviving is enough. Being here is enough. You are enough. This is In Search of 42. I'm Dr. Felix Boecker, and I need you to stay. Please stay. If you or someone you know is in crisis, here are the resources again. The National Suicide Prevention Lifeline is available at 988. Call or text 24/7. Veterans, tell them you're a veteran for specialized support. Text HOME to 741-741 for the crisis text line. Also 24/7 text support. The Physician Support Line is available at 888-409-0141. Confidential support specifically for physicians and medical students. Your local emergency room. If you're in immediate danger, go there now. Your therapist or psychiatrist, if you have one, call them. Most of them have emergency protocols. Please reach out. Please get help. Please stay alive. There's no like and subscribe request at the end of this one. If this episode helped you, share it with someone who needs to hear it. If you're struggling, use the resources I mentioned. If you're worried about someone else, please reach out to them. That's all I ask. Take care of yourselves and take care of each other. And I will see you in the next episode.